Okay, thank you very much and welcome to Flashpoint. And I want you to also be welcome to my personal page. I'm David Cote. And today we are here at the New Hope Clinic to have an interview with, don't mind the different, these are medical people coming up and down, so it's the same thing. We don't have to worry about that. This is Flashpoint, and I'm here today at the New Hope Clinic in Paynesville. And we are here today to talk to some of the patients here, maybe one or two persons, and to talk to the head of the area, Mrs. Reed. This clinic has been around since 1978, established by the late Dr. John Reed, her husband. Since his demise, the wife, who is now the head administrator, has been doing very well here together with all her capable staff. And so, we are live today all around the world on my page, and later on it's going to be on the Flashpoint page. Welcome to Flashpoint again.
Thank you.
Okay. We have been here on several occasions on the television portion of LNTV and the radio. Today we have gone one step further by going live now on Facebook. Now, tell us a little bit about New Hope. What's the history behind New Hope?
New Hope Clinic, New Hope Rehabilitation, Fitness and Health Clinic is a medical acupuncture clinic. And this clinic was established in 1998 by the late Dr. John K. Reed, a Liberian who was trained in China as a Chinese acupuncturist. He was trained by the Chinese as an acupuncturist. And he came and opened a clinic. The name New Hope is that he said, because this clinic was the first Liberian acupuncture clinic, the first Liberian acupuncture clinic in Monrovia. And then the New Hope came about because he said he would be giving the Liberian people new hope, a renewed hope. And indeed, the clinic has lived up to that expectation, up to that standard of giving the people of Liberia a new and a renewed hope.
Okay.
And this clinic, like we said, in 1998 was established, and first it was on the old road, but now the clinic is in its own building in this Paynesville clinic area. We have inpatient facility, we also have outpatient facility. The inpatient is a 12-bed clinic. So, and we have staff, capable staff that some are trained in China, some are also trained in China, and we are here to serve the Liberian people.
Okay, sounds good. We will be going to some of your rooms to see what you do here, to see what you're talking about when you say 12 bed. And we're also going to be talking to one or two patients who are willing to talk to us. And we'll also like to talk to your business manager, because people have said that your place is expensive, some people say it's reasonable, so she will tell us what to do here. But tell us about some of the illnesses you treat here. I know that the Chinese people say that acupuncture treats over 300 different illnesses, but the WHO recognizes 47. Now, how many of those 47 you do here?
How many of those 47? The 47, we treat not up to 47 illnesses, but in New Hope, the main cases that we receive here and treat here are stroke, CVA, which is cerebral vascular accident, hypertension, migraine headache, arthritis, rheumatism, diabetes, sexual weakness, or sexual dysfunction. Sometimes other things like the everyday talk of the town, things like malaria, typhoid, we also treat them here. But mainly any medical case, we treat them here. We treat Parkinson's disease, depending on when the Parkinson's disease has started. We can treat it that it can be subside, to a very successful rate. We also treat ulcer, PAD, and many others. Like I said, many medical cases.
Okay, we would like to know how acupuncture is administered. You may have a model here that you want to show, because acupuncture treatment is different from other treatments in other places. So how is it administered?
Acupuncture itself is a medical, it's a Chinese treatment that we do for varieties of conditions. And it is administered by using the fine silicone needles to treat, to insert at an acupoint. The acupoints are located along the nerve pathway on the body that you can see on this model. You can see the line. These are the lines represent the nerve pathway that we call meridians. These are the lines of meridian. These lines are like that in the human body. And the points that you see on the here, these are the acupoints. These are the acupoints. So these are the acupoint. The needles are inserted on the acupoint depending on the case, the condition that you are treating. Like for example, there is an acupoint here between the index finger and the thumb. Between the index finger and the thumb, this point we use it to treat varieties of conditions that originate from the head, like toothache, headache, any problem from the brain. We use this hergu, the Chinese man call it hergu. We use it to treat that case. And this may be a distal point for toothache or headache. The distal, because it's now located on the hair, even though there are other acupoints for headache and toothache that are located on the hair, but this is located here. It treats headache successfully too. So it's a distal point. We also have points that are local. For example, local points would mean that if I have problem with the ribs, there are points here that I can put the needles and other things. Then that's a local point, because there where the problem is, and then you put in the needle right there, so they term it as a local point. Okay, so that's how acupuncture is administered along the nerve pathway on the acupoint.
All right, now let's be specific a little bit. We want to talk about the major case that you normally receive here. I have been here on many occasions, and we have seen people here who could not speak, who could not walk, and maybe this is one of the reasons why you call your place New Hope, because I know of people who were taken from hospital to hospital who could hardly walk. They were dragging their feet, and like we're saying, like you're the people one side die, or you brought them back to life. Now, tell us about this stroke that is the major thing that you handle here, where when people have gone all over and failed, but when they come here, you bring them back to life. People have been in coma, and you brought them back to life. Oh, I mean, I said back to life, they were not there, but they were in coma. But tell me a little bit about stroke, because we want to go and talk to some of the patients and see your facilities. Tell me something about stroke.
Stroke is, like I said, it's called cerebral vascular accident. In the case of stroke, there is an accident that occurs, but it occurs in the brain. For some reason, the vessels that supply blood that supply oxygen to the brain is damaged. In the case of hemorrhagic stroke, the vessel is burst and is open, and the patient is bleeding in the brain. In the case of ischemic stroke, the vessel is blocked. So when the stroke patient come, sometimes they come to us when maybe they have already gone to other hospitals, so the emergency part to try to arrest the bleeding or try to arrest the situation right there, it has passed. But when they come, we try to see what is the cause of the stroke. Sometimes what's the cause of the stroke? Most of the stroke that we receive here, they are caused by hypertension. sometimes hypertension, sometimes diabetes, sometimes it is caused by immune deficiency syndrome. Maybe the immunity is compromised to some extent, and then the patient will have stroke. So then when they come, we treat them to bring them back, to revitalize them, to revitalize the system. And when a stroke occurs, most of the stroke either is a wind stroke, that the person get up and the mouth is twisted, they can't speak or so. So depending on from our assessment and from our laboratory work and everything, then we come up with a diagnosis. We try to treat the underlying cause and we treat the stroke, and then we insert the acupuncture needle. So the needles for stroke are inserted, that we say, to the heart goo. The other point below the knee here is called Zusan Lee, is stomach 36. Then we insert the needles on the thigh, depending on which side of the body that has the stroke. Okay. So yeah, so that is about stroke. We also have some Chinese medicine that can treat stroke very well, that we have from China. We can also give the patients to help, to bring the patient back to life, to reawaken the nerves to start to function properly.
Okay, now we don't want to talk about all of the illnesses you treat here, but let's ask about your main location and your contact numbers. The public, we are seeing 87 followers playing right now, playing. One share and some comments. And if you are following, we'd like to appeal to you to please share this program. Thank God that we have about 87 people watching now from around the world. And one share, one runner down, thank you. And those of you who are watching, please share this to other people so that people can be aware. There are people right here in Liberia who have these problems and don't know where to go. And do not know where to go, because most of the time when the people come to tell me, you have to do more awareness, because we do not even know that this place is here. We do not even know your location. We do not even know your number, which we always announce on the air. Okay. Our numbers are 0777 517464 or 0886 559014. Better still, when you call Honorable Kuti, he will be able to give you direction and link you with us. And his number is 0777 511977. So these are our number. We are located in Paynesville on Sopini Road, right around the area they call Nigerian shop. I think I remember one of the numbers too. That is the business manager's number, 0770 210 790. 0770 210 790. You can talk to her too. She'll give you more information about what to do here. All right, we'll be going to talk to some of the patients with your permission. Yes, you can go, you can talk to the patients, you can check in the rooms, and you hoping them I got no secret besides to help the Liberian people and treat patients with acupuncture. Yeah, okay. And acupuncture also treats some nerve condition very successfully too. Okay, I will not leave until we talk about one or two, because it is not everybody who comes here with stroke problems. No. What are some other illnesses that you receive your most? I learned that arthritis. Like I said, yes, some nerve condition, arthritis, lumbago, and those kind of things. The patient, they come every time, every now and then. Arthritis is a condition in which there is inflammation of the joints. And arthritis, more especially when it is chronic, it's very difficult to manage. The patient will have pains, they will have swelling, and then they will just continue to take pain medication. But with the acupuncture, the pain medication can be minimized, and then with the acupuncture and the Chinese medicine, the patient can recover from arthritis, more especially if they are just started. Like somebody will tell you they had arthritis, they had a condition, they came here and we treated them and they were all right. They came yesterday, now what she was talking, she fell off with stroke, but she said she was sick before she came to the clinic and we treated her.
But this time, because she felt all she was talking to the people or not listening to her, and she kept talking until her granddaughter that was managing her said they already saying that we should carry her for acupuncture. That's how they managed to look for the place and bring her here. And then they brought her here yesterday. So acupuncture treat many other conditions besides stroke.
Okay. All right, we'd like to take your permission now to talk to some of your people. We'd like to go first. But before that, do you have a laboratory here?
Yes, we have a laboratory here that will do some chemistry lab, routine labs, and some chemistry lab. For example, we do cholesterol test here. We do PSA, which is the prostate enlargement test. We do also test, which is H. pylori. We check for the H. pylori. We do even the viral test, the hepatitis test. We also do it here too. So yes, we have a laboratory here. When the patient comes, we check them, and then depending on what they're presenting in our assessment, we send them to the lab to do some laboratory work. And many of the time people will say, so how much for the lab? So it's difficult for me to say how much for the lab for the patients, because patient A will come, depending on their condition, I will order certain lab for them. When patient B comes, depending on his condition, I will order certain lab. So it's difficult for us to know exactly how much for lab for the patient. It depending on the person's condition. Likewise, the same way with the treatment.
Okay. Well, we'd like to say many thanks to you for talking with us. If there's a need, we will come back and talk to you briefly before going.
Okay.
But what we want to do now is to talk to the business office to give the public some idea as to how your financial thing is done. I'm glad about the feedback we're getting from here. But it's important that people know how much you charge for certain things. And so from there, we'll be going to talk to one or two of the patients. Well, thank you very much for the time.
Thank you.
All right, and we don't have to cut off, we're still on. We're moving now to some of the... Right? Now, this is the hallway. We like to talk to the two persons Let's see what we can talk to the business at the moment, you can stay here. We just got to talking to the chief administrator. We will talk to one or two persons here, especially first of all the business manager that we call the governor of the central bank. So, Governor, can you please talk to Flashpoint? We've just been talking to the CEO, and my main reason for coming and talking is to give us some brief information as to how you do your financial things. Most people like good treatment, but sometimes they want to come and they want to know how much you charge here. For example, for stroke. Now, tell us exactly, that's one of the major things that is being done here. When people go all over and can't treat their stroke patients, this is where they come and get treated. That's why you call this place the new home. Now, how much do you charge for treating stroke?
Once again, I'm saying good morning to everyone. I hope they have a pleasant day today. For here, we treat stroke, but when it comes to the financial area, the registration is 15 USD. That includes registration and consultation. The consultation is $5, registration is $10. When it comes to the lab, we can say it because the doctor has to see the patient. The lab press varies. It comes from like 40, 45, 50, 60, just like that. Depending on the patient condition, the lab that will be ordered, and then we know how to press the lab. But the first thing is the patient will register with $15. Then when you come to the lab, after they have come from the doctor office, then we know how to press the lab. Then when it comes to the treatment, again, the doctor will have to get the prescription, then we know how to bill it. So we can say here how much it will cost, because it runs from up to down, from down, up. Sometimes it's between the 60, 75, 100. It's just that.
Okay.
So we can say how much right now. So before someone can say, but you told me they were going to be this, but I came and it is not that. The only thing that is constant is fixed is the registration.
Okay.
That is the $15, which include the
Consultation.
and the registration.
Do you accept the equivalent in Nigerian dollars?
Yes. We take the equivalent in $100.
We're coming back to you. I know you're very busy, we won't be here too long. Can we talk to two of your staff members quickly, please?
Yeah.
Your name, please.
I'm Mrs. Priscilla Chibu.
Oh, okay. So, what can you tell us about your occupation here? I mean, what do you do here? What's your position here?
Okay, I'm new here as the hair nurse for the nursing department here. So we are here to receive our patients after they have gone through the doctor office, after they have settled their financial bills. Then we are down there, we receive the patient. If they are to be admitted, we can admit them. If they are to be on the outpatient department treatment, we will also help to treat them. So we can...
I see you people so friendly here. I see good relationship between patients and the nurses here. Why do you do that?
Wow.
Sometimes I hear Wida telling some of the patients, look, my boyfriend, go sit down over there. Then the man will say, my wife, leave me small, let me just rest myself small. Then why are you so close to your patients?
Because it helps our patients a lot. It helps our patients to get better, faster, and it helps our workload to be very light.
Okay.
So we do that to lessen our burden. Okay. So when you are working with a patient and you're talking and laughing, the movement will be so smooth.
I see.
So we are just like that because it makes our patient feel good.
Thank you. Dr. Moses, even though you're not a medical doctor, you say you don't want to be called so, but you have been here from the ground, rising up, and you've been doing some errands here. Today you are in a medical school now. And you told me, and the Madam herself told me that after your training, you will tell us where you're going to school now, which medical training you're doing. And I was told that when you finish, you're coming right back here. Tell me more about it.
Okay, thank you.
First, your full name. Yeah.
My name is Moses Enya, student of the Government National Institute of Medical Arts, where I am currently a junior student. So I am a physician assistant student. So I'm there and I'm here in New Hope, as you rightly put it. I've been here occupying various capacities. I serve as janitor, I serve as driver, I serve as security, and what have you. But now I find myself in the medical school. I'm in training by the help of this clinic, and after graduation, I'm coming right back in the clinic to be able to work here and serve the clinic and that of our patients. So that's actually why I'm here. And for now, I'm here as a medical student. I come here to do practice. I go talking to my boss, they tell me what to do, they tell me what not to do, and all of those things. But I'm okay, and I tell them that we are all here together working.
Okay. We're not going to keep you too long, but we want to know what motivated you to get into the medical area. Is it because you see patients and you feel for them? And number two, to be a registered nurse is one thing. To be an acupuncture nurse is another thing. Now, do you have an intention one day to go to China like most of the nurses here did, like the CEO did, to go to China and get more training in acupuncture?
Oh yeah. So we talk about what motivated me to choose the medical field. When I was in this clinic, janitor, so I used to receive a lot of patients. So every time the left at the room would tell me, say, Moses, go and do this. Moses go and clean the Bible. Moses go and take care of the patient. So from there, I started to have empathy on patients. I started to see myself in that condition. Like if somebody is sick in this condition, I think it is better to help them. And looking at the clinic and being here as a janitor, at the time I decided, I said, no, I can't be janitor. Because even if you talk to me, Moses, I want you to do better. I want you to upgrade yourself to a level that you'll be able to work in the clinic. When it comes to me going to China, oh yes, I got great interest in advancing myself. Even beyond China, even if I don't have any other place to go to get myself, doing those things that I want to do, like acupuncture nurse or acupuncturist, whatsoever the case, I want to sell the clinic, I want to sell Liberia.
Thank you very much. Governor, can you please take us to somebody who would be willing to talk to us briefly?
Yeah, I got my boyfriend here who is willing to talk to you. Your boyfriend?
I need to see that boyfriend.
Okay.
Yeah, so,
I will take you.
yeah, this is the lobby of the clinic. So these are some of the guests and some of the patients in the clinic. We can talk to those people who are willing to talk to us. Excuse me. So,
Okay. One of those I will talk with.
okay.
But if you are telling you say my boyfriend, you can talk to my boyfriend.
Oh.
Not my boyfriend, you can talk to what we have.
I'm a jealous person. You can't introduce somebody to me as your boyfriend. Your name, sir?
Mr. Jackson.
Mr. Jackson?
Erickson.
Thank you. Well, I just trying to say you got a boyfriend, but she just putting some little joke in. I had to do here.
Yeah, I understand.
Thank you. Now, what are you here for? What was your problem before you came?
Let me just make it short.
Okay.
In 2021, I was diagnosed to go to Ghana.
Okay.
I was diagnosed to go to Ghana, and went through the process. But my wife, they used to took me. I don't like to call doctor name, but I only knew surgeon in the country. And let me call his name Dr. Doe.
Okay.
Dr. Doe.
Okay.
He said they think I don't know where of, and I needed to go to Ghana, for this operation.
Okay.
But then I was in the office one time because they used to took me in the office. But then I don't know if I just I got up. When I got up, I sat down. Then he said, but my man. Then he asked me, he said, in this country here they have one doctor release on the whole room.
Okay.
Do you know the place? Because I've been out of the country for long. I said, I don't know what you call Dr. Release. I don't know. And I'm time in a critical condition.
Okay.
Couldn't walk, nothing. Yes. And one of my friends found this place.
Okay.
Came here, I was totally healed. I'm not joking with that.
All right.
My brother, it's totally healed, walking, drink. But the mistake I made on myself because they told me to come back to keep checking up.
Okay.
Checking up. Did not come back.
Oh.
But then suddenly something happened. I came through operation at JFK because when white people came to see that the same thing was happening. So I went to him, he said, you locked in my brother, the people come, but the same thing I tell him, I'll tell you. So I went through all this, something that, our diagnose, one of the span of one of the bone was laying on my spinal, the spinal cord.
Yes.
There's running through one of them. He showed to me.
Okay.
Actually, that I was laying on my spinal. They were laying on my spinal cord, the white man.
Yes.
He said, if you don't correct the mistake, you will end up in a wheelchair. So I did not want to take that risk.
Okay.
Yeah, so I took the operation. After the operation, according to the same doctor, though he said it was successful, all you need to do, your only thing is the physical therapy, PT. That's all you need now. Okay? Come to yourself. So I say, I will now do anywhere else, come here. They say, totally coming here. Stay taking the treatment, I can walk on myself.
Well, that's the main thing I want to hear. We thank God for that.
See, I can walk by myself now. That's what I'm doing. for them.
Okay. Well, I thank God for you too. And thank you for the testimony. Thank you for the testimony. Okay? Yeah. Okay. All right. Thank you very much, sir.
Thank you.
Okay. Yes, sir. You wanted to talk to us?
Yes.
Okay, thank you.
How are you?
Fine, not bad. Okay, please don't feel any other way. We just trying to encourage other people who have similar problems. You have to come here. You know, we came here one time with our television crew. There were people who were having problems in certain places who did not know where to go.
Yes.
But when you watch people here,
Yes.
especially the one CDC Pape, he called himself CDC Pape.
Yes.
He was in coma completely. You know, the Madinga people don't waste time with their body. They almost bury him until somebody said, no, let's go try New Hope. So when we saw him giving his testimony on television, I had some people encouraged to come. So that's what we're doing here. So you wanted to talk to us a little bit?
Yes, yes,
Okay,
yes.
thank you. Your name, sir?
My name is Alhaji Kaiser Pamula.
Okay.
Well, first of all, thank you very much. I know you from the day one as an honorable
Yes.
from there, and then our sponsor of the, you know, the girl.
The girls
And,
thing.
okay.
Yeah.
Well, first of all, I thank God. You know, this clinic here, you know, they were living on the oral.
Yes.
Yeah. They call him Dr. Reed.
Right.
I even, you know, I got sick. I went there right behind the market there.
Yes.
I went there, I had a treatment, and then I get better. Okay. Now, the few days, you know, they did Ibrahim Day. You know, I get us keep I divide everybody, you know, then they pray for me. And Monday, Tuesday, you know, while I was going, then I almost fell. So I almost fell, and then people they can't hold me, you know, and carry me inside.
Okay.
They carry me. So one of our sister, you know, she had a stroke.
Okay.
She came here. So right away, you know, then my wife said, well, the best thing what you had to do, all we had to do, let's call the woman. And then, but for here now, that time, I don't know here. I only know on the oral.
The oral, yes.
Yeah, on the oral behind the market there.
That was the day before,
Yeah.
yeah.
So then the woman took me and we came here. You see, cutting from here straight, coming down.
Yeah.
The one part, I don't know whether it was a part of me.
Oh.
I don't know whether it was a part of me. So they put me in a car, the same car, you know, they brought me here and then they put me in the wheel, they bring me, and then they start treating me. Once I came, I think the 10 days. 10 days, you know.
Okay.
That time I can't even think, you know, to live for the thing, come on, they hang here. But right now,
You can live it out now.
yeah,
Oh,
I can
sounds
live
good.
for, you know, even the 4, like this one now.
Yes.
I can walk with, you know,
Yeah.
like they want here, I go on the road. So I've been taking the treatment here,
Okay.
you know, and then I'm able to successful. And I even recommend, you know,
Yeah.
the only thing they do, you know, I used to, you know, they treat as their own. Sometimes, you know, I can go with my children and they can give me the, how they call, the physical training
Yeah.
to my house.
Yeah.
So, but every day, you know, they did the show Monday, Wednesday, and then Friday, 3 days. I always am coming here and take a treatment. I go back. I live on the airfield,
Okay.
right to the zone
Okay.
that I play out of council.
At least, thank God, there's a big difference now
Yeah.
since they've been coming here.
Yes.
That's the main thing I want the public to hear.
Yeah.
Because somebody sitting somewhere, they have tried from one place to another, no way. But when they hear that somebody came in a different way and they improve it, they will encourage them to come also.
Yeah, exactly so.
Thank you very much.
Yes.
We may come back to talk to you.
Okay,
Thank
thank you
you.
very much.
Anybody else want to talk to us, please? All right. Let's go. Thank you.
Okay.
Now this is still a part of the clinic. And going down the hallway. This is the staff office. We will not talk to everybody. But this is the clinic itself. They call this one Ward 1. Ward 1, okay, we're not going to be talking to anybody here. People, how are you? Okay, this is one of the clinics. And the main reason why we're doing this, as we're saying to you, the public, is that people have certain problems and don't know where to go. But when they come when they see these things, then the courage should come. I remember there was a man who was taken all the way to Uganda. He was there for so long, but his stroke could not be treated until he heard this thing on the radio and he came here. So good morning to everybody, and I wish you good luck. But anybody wanting to talk to us, we can talk to you. Yeah, I'm David Cote, yes. Yeah. Thank you. You know, sometimes yes. Okay. Thank you. Right. Thank you. The main reason why we're doing it, like I said, sometimes people are sitting home. They're getting paralyzed. Like we say, like the person one side down. But they don't know where to go. Sometimes you go to a big hospital, they don't have the treatment for this thing. But it's acupuncture that can treat this particular kind of thing. In fact, I had to call this place stroke clinic or pressure clinic. So when you go all over, they can't treat it. When you come in, the acupuncture can bring it back to life. So they call it New Hope Clinic, and some people call it pressure clinic. But thank you very much. We just been talking to some patients, wanted to see whether somebody willing to talk to us. Yeah. All right. Thank you very much. I wish you all the good luck.
Thank you.
Thank you too. All right. We will come down this way. We'll stay in the hallway. There are many rooms here. This is another place. All right. We can talk to everybody here now. The one of my people, how are you? Thank you. Thank you. This is one of the rooms here. This is Ward 3. Thank you. All right. Okay. They even prepare food here for the people. A special type of food they prepare for the people here because of certain conditions. Hello, my people. Okay. We just want to know somebody here who wanted to talk to us. We are trying to encourage other people who don't know that this place to come. Sometimes when you're sitting somewhere, you have a particular illness, you don't know where to go. When you hear about other people's testimony, you will to come. So thank you. Everybody want to talk to us here? Okay. Thank you very much. We wish you all a good luck. Sure. Thank you. All right. And like I said, they prepare food here for the patients. All right. We have another section, another bed here. That's good. How are you? This is the kitchen where they prepare food for the patients. Thank you. We can talk to the other way. We can talk to the people in the kitchen. Anybody there? Yeah. Okay. All right. All right. This is the kitchen area. Madam? How are you? Who does they cook here? Okay, you see, they carry food now to the patients in there. They prepare special kind of food here for them. Madam, we can talk to you small? Yeah, not anything too long. So, why do you people prepare special food here for the patients? They say because, come in here. They like this to be fine. They say the patients gotta eat special kind of food, huh?
Yeah.
Okay, so what special kind of food they can normally eat?
They eat 6 times a day. In the morning, we go come over for them.
Yeah.
12 to 1, they eat rest. Then in the evening, we cook. We get them tea and bread.
Okay.
Yeah. And the food, you can cook oil. You can cook pepper.
Okay.
They get special vita for them.
Oh. Oh. All right. Oh, I see.
Yeah.
So it's a special kind of vita that they cook for them.
Yeah.
I see.
The soup, you go potato green. You go belabo. You go arrow.
Yeah.
You can go okra. You can go quesadilla.
Oh.
Yeah.
I see. I see why you have the okra here.
Yeah, the okra is for the water.
Okay. All right. Thank you very much. We just wanted to know because we heard that they prepare special food for the people here.
Yeah.
Thank you very much. Your name?
My name is Princess Coin.
Okay, Miss Coin. Thank you very much.
Welcome.
Thank you. Have a good day.
Thank you.
All right. Now, we'll just go to the front part of the building and enter the building from the front part.
Okay.
So we're still moving around the clinic. We're already outside. Maybe we can give a view of what the clinic looks like. the light. This is the parking lot. This whole area, that's the clinic you see here. All right. And this entire area is the parking lot. A lot of cars parked this way, especially when there are so many. So this is the parking lot. The people come here and put their patients down. And so, okay, there used to be a sign that has been removed now. But this is the main entrance. There are two entrances here. One from the other side, one from this side. And there's a plan in the future to have a VIP place where certain people who may be in the high hierarchy who may want to come and be by themselves. That's a plan to have it. Now let's just go and have a final discussion with the Okay, this is the laboratory. Started right here now. Okay. I'm sorry, we're going to have a break. It's coming. We can't be here too long. The air conditioner is blowing me too much. I can't stay in your air place too long. Now, what are your final comments now so that we can leave? You have a patient before you.
Okay, we have patients.
Yeah, wait, let me inform you. We talked to two patients. We talked to your business manager, and she explained similar things that you have always said. But then we talked to two patients who talk so well about here. How they came. Yeah, I'm sorry you don't have to, but you were watching this evening. How they came, with the condition they were in before this time. Other man said, you see my foot, I can lift it up now, my hand. So that's a good news for the place. So what are your final comments? We even went to your kitchen, where you prepare food for your patients, and they told about the kind of food they can prepare here. So what are your final comments on before we can leave to the nation and to the world? Because there are people sitting in places with certain illnesses and don't know where to go. That's why we came. So the testimony from people here now and your final comments, and we can leave.
Our final comments. We say thank you for coming, and our final comments that New Hope, we have a slogan. We say we are here to serve you. So we are here to serve the Liberian people. We are here to serve the public, and we say whenever you are sick and whatever it is, you can come to New Hope. We are here for you. Thank you.
Do you have partisan business here, or you treat everybody equally? I also know that you are a reverend, you have a church, and so on. But do you treatment here based on Muslim or religious matters?
No, the New Hope Clinic is a medical acupuncture clinic, so we go strictly according to medical ethics. We treat everybody equal. Which party you from, which party you not from, which religion you from, which religion you not from, we treat everybody equal. Even like the man that came here, he came and said, I want to talk to you, I want to talk to you. He's a Muslim man.
Yeah, the CDC
papi. Yeah. Even the one who was just talking to you over there, the relative, he said, came here, she's a Muslim woman. And many other Christians, many other Buddhists, people who do not have religion, we treat everybody here equal. When you come here, you come to the clinic.
All right.
Even partisan, we don't have special partisan that we treat special way, no.
Okay.
Everything here is across the board and equal.
I'm sorry you have a guest, a patient we can't keep too long.
Yeah.
But thank you. We have 6 likes, 3 comments, 3 shares, and 206 people watching you now around the world. Thank you very much for the time.
Okay. Thank you. God, thank you.